Also tonight, 7 Eyewitness News continues to ask questions for you surrounding the indictment of Dr. Eugene Gosy.
His Williamsville doctor office now closed for the next 2 weeks. That will leave some 10,000 patients wondering where they're going to get their pain medication.
Tonight, for the first time, we're hearing from someone who works in that office. 7 Eyewitness News reporter Ed Riley spoke to one of the doctor's practitioners.
So the patients of Dr. Gosy, since the indictment has gone down, have really found themselves in a hard way.
Douglas Pierce is a nurse practitioner who works in Dr. Gosy's office in Williamsville. He's now unable to help his patients because Dr. Gosy's pain treatment center is closed until May 16th.
I would contend that it's an acute crisis.
But his patients are reaching out to him as they run out of pain medication and find their primary care doctors are shunning them because of the stigma attached to the indictment.
But lest we forget that the primary care physicians were actually the offices and practitioners that sent these patients to us. Thus, they're very apprehensive to write these medications.
Pierce is upset because he feels patients were forgotten during the indictment of Dr. Gosy.
Whether you believe Dr. Eugene Gosy is guilty or innocent, there was no contingency plan enacted by the powers that be.
The U.S. Attorney's Office said it had to preserve the secrecy of the grand jury investigation and claims a large number of Dr. Gosy's prescriptions were fraudulent.
Comparing our office to a 19th century opium den, that is absolutely absurd. Our office is very professional. As I said, we follow, myself and the other providers follow strict guidelines in terms of urine testing, pill counts, tracking patients through the prescription monitoring program.
Dr. Gosy's office has 10,000 active patients, many, Pierce says, with painful conditions from surgery and disease.
And if we're having town hall meetings and conversations about the link between opioid addiction and heroin, and we're pulling the rug out from under patients that are on chronic opioid therapy, I question the logic of that.
Pierce fears many of his patients will be going through severe withdrawals, and suicide could result.
And the patients right now are the ones that are in danger.
County health officials are aware of the growing crisis, and they're putting together an emergency action plan to get primary care doctors more involved in treating those patients with chronic pain.
It's not going to be easy for anybody, and we just have to work together in our community to, be able to figure this out.
Pierce said he plans to push for answers, and he will be at the Erie County Opiate Epidemic Town Hall meeting this Wednesday in Kenmore. But county officials say they are putting together an emergency action plan, and patients who are having problems with their medications can call either 211 or go to any federally qualified health center if they're having problems dealing with their own doctor.
Good information. You just hope these patients are going to get the help they need.
Absolutely.
And surprising that the authorities didn't put some kind of a plan, get it ready before they took this guy out, because couldn't they see this coming?
Well, they could, but the problem is it's the secrecy with the grand jury proceedings. The U.S. Attorney's Office said they couldn't divulge anything of what was happening until they released it to all of us in the public. So the same time we found out, the Erie County Health Commissioner found out.
Interesting stuff. Thank you.
Well, the Opioid Epidemic Task Force here in Erie County is trying to find a way to fix this problem. The group held a meeting today, but before the members got underway, the task force highlighted a new program that's called REAP. That's R-E-A-P. It will give addicts a streamlined path towards treatment and rehabilitation instead of putting them in handcuffs.
Addictions is not an undesirable behavior, it is a disease of the brain. And we typically don't incarcerate other individuals that have other diseases that require medication. And so we certainly don't want to incarcerate people who have addiction, which is a disease in the brain.
Here's how this new program will work. If an addict comes to the police and asks for help, then they will be paired with a volunteer angel, as they call them, who will then guide them through the process. Now, if that person has drugs or drug paraphernalia on their person, police say they will confiscate it, get rid of it, but you will not be arrested.
Also,